Good afternoon. Welcome to the November 8th, 2022 Board of DSS Board Meeting. I'm glad y'all are all here. I'd like to call the meeting to order, and before we move into our agenda, we will observe a moment of silent prayer or silent meditation. Do we have any public comments?
No.
Okay. All righty, so we need to adopt or revise. Do we have any revisions to our today's agenda? May I have a motion to approve today's agenda?
I'll make a motion to approve the agenda.
Second.
All in favor?
Aye.
Okay. All righty. Have you had a chance to review your minutes from the previous meeting back in October? Any changes or anything that need to be done to the minutes? Nothing?
Move
May I
to
have a
adopt.
motion? Okay.
Second.
All in favor?
Aye.
Thank you. Okay, I'll turn it over to Ms. Rochelle to talk to us about the recognition of new hires.
So I'd like to call Sydney Roach up to the microphone. Is she not here? How about Evelyn Keenan? No? Okay. Well, there are new hires, and we welcome them aboard and welcome them to Pitt County and wish them well.
Thank you. We do not have any items for consent today, but we do have several agency reports, and we will start with Angela Hart.
Good afternoon. I want to give you a quick update on the October numbers for our revenues and expenditures. Right now, these are preliminary numbers because finance has not done their maintenance, so they haven't closed the books for the month yet. Revenues for October, we have brought in $7,123,272. That's a cumulative amount now. That's not just what we brought in for the month. And as of October, our expenditures are at $9,358,286, and we are pretty much on target with everything that's going on with our vacancies and our extra projects that are going on. And the next thing that we have are the vacancy update. As of October, we have got 51 vacancies, so we're 2 less than what we were last month, so that's a good thing. We've only got 1 position that's frozen. We have 1 position that's in the interviewing stage. We're advertising for 17, and we're screening for 37. We've got 4 that are still pending state approval. I think I've gotten 2 of those back today, if I'm not mistaken, but I'll have an update next month when we have the meeting. And we have filled 8 positions since our last board meeting.
Very
So,
good.
any questions?
Any questions? No?
Okay. And I'll give you a copy with the numbers on it. I didn't have them when I actually did the board packet, so I'll give them to you.
Okay, thank you.
Thanks, Angela.
Okay, Rhonda Dawson, she'll come talk to us about child welfare.
Good afternoon, y'all. I was asked to talk about our child welfare numbers. So we've had a lot going on. In the past 2 weeks, we had 277 families seen that were in the assessment phase. It took in-home, permanency planning, assessments, supervisors. It took all of us to make that happen. But we met that 277 deadline for those families, and our next goal is to get those families closed. In September and October, we have closed 198 assessments. But we're continuing to get them, obviously, and we currently are averaging about 150 reports per month. So they're coming in just as quickly as, trying to get them closed, but we're trying to get through all the backlog as well. Currently in our in-home section, they currently have 89 in-home cases open. 14.5 positions are budgeted for that position, for that function, and they have 7 positions vacant. So all the workers in that function are well above standard. Standard is 10, and they're all carrying between 19 and 20 families. That position, that function also has 3 supervisors, and right now, it's got 1 supervisor, and she has also been promoted to the manager of that function. That's Colleen Anderson. In addition, in that section, they had 18 open CPS cases. They closed 5, and they closed 10 in-home cases in the month of October. In permanency planning, licensing adoption, we currently have 10 families that are in the process of being licensed. We currently have 223 children in foster care, 17 children in our 18 to 21 program. And within that, we also currently, since last week, have had 2 children who have been staying at the agency with our staff. So we are providing round-the-clock care for those kids when they are here. So those are the numbers in a nutshell for that. Do y'all have any questions?
Any questions?
I have a question. When children stay at the agency and they're provided 24-hour supervision, how are those shifts divided amongst the workers? Do they come in 8-hour shifts or 12-hour?
I do 5-hour shifts.
5-hour shifts, okay.
And it's 2 staff.
Uh-huh.
Last weekend was the first time in my 9 years we've ever had to have staff stay for the whole weekend.
Mm-hmm.
Normally, it's just a night here or there. And we had to have staff stay from Friday to Sunday, and it took 20 staff who had to give up part of their weekend, and that's in addition to the folks that, for the other child that we had to stay for the first part of the week. The weekend, I was able to pull staff from adult services and across the river who were willing to assist, and I paired those folks with our regular permanency planning or CPS staff.
Sounds like great teamwork.
We're trying, but we're making a plan for now because we're back, so.
Mhm.
So I just want to make a comment and commend the staff for actually meeting that goal that was insurmountable, and they all pulled together to be able to do that. Unfortunately, I think right after that, we started having those issues with children staying at the agency. And so, you know, to put in all that time and effort for those couple of weeks before to get the caseloads down, and then staying here night after night for, you know, a couple of weeks, and it's been more than 1 child. So just a couple of things. I've talked with Janice Gallagher about meeting with Trillium to see what other options they have. We're not the only county that is experiencing this. It's not even just a North Carolina thing, it's the whole United States. They don't have placements for these children, and unfortunately, they come back to the Department of Social Services. Other facilities can say, no, we cannot. They're our children and we need to care for them. But it's not easy on staff, and you know, it's taking away from their work-life balance. So we're going to see what else it is that we can do to try to get additional help. If it means hiring per diem staff to be able to come in to take some shifts away from the regular staff, whatever. At this point, we're just looking for every alternative. But I can tell you that what I've seen happen in the last couple weeks is truly miraculous. And I can't say enough for the staff here and what they've done. And they just do the right thing every time. And Rhonda has been absolutely phenomenal, and kind of leading the charge and getting things done. And that's with all the other day-to-day work that goes on here. So she needs to be commended also for taking the leadership
It's a
role.
team. So,
Thank you, Rhonda.
Any other
more
questions?
All right, appreciate it. Okay, Chandra, Newbern, would you like to talk to us about Bready Bear and holiday cheer?
Yeah.
And that
Good afternoon.
time of year.
Hi. As we always do, we did our yearly Bread and Bear fundraiser. The kickoff was October the 14th at Great Harvest Bread. It was Pitt County DSS along with the Bridge Foster Ministry. As of date, Mr. Green is still working up the figures, and he will present the agency with the check. That check will be split between the Bridge Foster Ministry and DSS. The week of the 14th, the 17th through the 21st, we had our staff, we had staff from child support to go over. They made the breads, they bagged the bears, they did everything, and it was a good turnout. We had community partners there, we had the sheriff there, we had some more elected officials there, we had board members there, and it was just a real good time. So we really enjoyed doing Bread and Bear, and it uplifts our staff and it helps the children that we serve. So any questions about Bread and Bear?
It was fun. Very competitive.
Yeah. And as always, we are gearing up for our annual holiday cheer program. As Rhonda said, we have about 223 children in foster care. If you add the 18 to 21 population, that brings us to 240. When my staff and I go out in the community to try to engage partners for this, we do try to get it for our agency as a whole, not only foster care, but in-home services, investigations, and our 18 to 21 population. We did a media, VOI did a media blast yesterday, and our phone has been ringing off the hook since that media blast. We've had a lot of people that we work with every year to sponsor our children, but now people are moving more into, like I said, our in-home, our investigations. Just today we're partnering with the State Employees Credit Union. They're going to do some general stuff for us, and so we'll be able to serve all our families that will be in need. Once we get over here, and we get all the toys and we get everybody that we need to have them, I do call across the river, and it's like I send stuff over there as well, because sometimes you have families in need going over there too. So we just try to spread it up and share it with everybody. So if you want to sponsor a child, if you know anybody who wants to sponsor any children or families, give us a call and we'll be able to provide you with the wish list. Any questions?
Thank you, Chandra.
Thank
Thank you for all that work. Okay, holiday cheer for adult services.
Good afternoon.
Good afternoon.
My name is Allie Vera. I'm one of the adult services supervisors, and I supervise our two adult home specialists who are our social workers that oversee the Adult Foster Holiday Project. The Adult Foster Holiday Project has been a program within the Adult Services Division of Pitt County DSS for the disabled adults residing in the facilities in Pitt County, as well as adults that Pitt County DSS serves via Adult Protective Services and guardianship. Many of the elderly and disabled adults living in residential facilities in our county receive as little as $90 a month to cover the cost of their medication copays, clothing, and personal items. And these same individuals have little to no family support to help them financially in purchasing these things, and much less they don't have the support to purchase the items that they wish to have for Christmas. Pitt County DSS is also legally responsible for numerous adults age 18 and older who also reside in residential facilities, and these individuals are also without supportive family and have limited income. The Adult Foster Holiday Project has been providing a means for these individuals to not only get the items that they need for this holiday season, but also the items that they can enjoy, and they've been doing it for over 40 years. We are reliant on the generous contributions of agencies, organizations, and individuals in the community, and the items that are donated include, but are not limited to toiletries, clothing, snacks, games, activities, etc. And if you or someone you know is interested in sponsoring a disabled adult, please contact our adult home specialist, Jennifer Stroud, or Kim Melvin, and they can assist you. I also can assist you. And we've had a lot of sponsors pouring in already, so it's been very successful every year. Any questions?
How many individuals are we talking about?
In guardianship alone, we serve not quite 200 individuals. I think it was 492 was the last count that we had this week. And that doesn't count the adults that reside in facilities in Pitt County that are just residing in Pitt County that we don't, and that doesn't include adult protective services either, so. Any other questions?
Thank you.
Thank you.
Thank you, ladies.
Okay, Brian, Mr. Averett, you want to come up, talk to us?
Good afternoon. First, I'll report on the Food and Nutrition Services Program. We've talked previously about the fact that the agency is not meeting the 95% processing time frame for food and nutrition services applications. And this has occurred as a result of the high volume, the increase in volume of actually applications received in the agency and our vacancies in the Food and Nutrition Services Program. And I'm going to share some strategies we're using to move toward bringing our agency back into compliance. In intake, there are 11 positions dedicated to Food and Nutrition Services applications, and of those 11, we currently have 4 vacancies. On November 14th, next Monday, I'll have 2 new employees starting in intake, and one of the employees has experience working in Food and Nutrition Services. The other employee has had the NC Fast case management courses at the community college, so she'll come in with an exposure to the case management process, but she will need training in the Food and Nutrition Services policy. And in the redetermination section, there are 16 positions dedicated to redetermination for Food and Nutrition Services cases, and I have 5 vacancies currently of the 16 in that area. The strategies we're using to work on the applications are, we are and have been assigning applications also to our redetermination workers, because the redetermination caseload now is lower because the state is extending cases of food and nutrition services for individuals who have had at least one review in the last 6 months. So if their review is due, say for instance in November, and it's only been 6 months since they had been reviewed, that case is extended and they'll be reviewed again 6 months. So at 12 months they would get a review. So that's allowing us to utilize staff in the redetermination section to work on applications in addition to the redeterminations they're working on. We also, staff are also working paid overtime. We received an allotment from the ARPA, federal ARPA funds that are designated for food and nutrition services specifically for the program, and we are able to pay our own staff who are interested in working overtime, and we're designating this for applications, food and nutrition services applications. They are working overtime. 10 individuals worked this past Saturday. Employees are also coming in on their off day, because some of them are working a 4-day work week. So they'll come in on their day off and they'll work 6 hours. 6 hours is the amount of time that we're allotting, so that they're not here the whole time on their day off, but they are getting a lot done during that time. And that seems to be working well. We have had a lot of people volunteer in those 2 units to assist with this, and I'm very pleased with how both sections, redetermination and intake, are working together, and they have really stepped up, and it's not for a lack of effort. It's just the numbers are what's driving this, and it's a very fluid situation with the numbers coming in and then the fact that we have vacant positions. We are also going to use 2 individuals through a social services staffing agency who can assist us with FNS applications. They are seasoned employees who already have experience working in the program. So they already know the program, they know how to use NC Fast, And as they get resumes, they forward those on to us, and we look at them, and we could, you know, we could add on additional ones as they are available. So those are the areas that we're focusing on, and the techniques that we're using to try to bring everything back into compliance. I'll be happy to answer any questions you have about the Food and Nutrition Services project.
Brian, could you just speak a little bit about the federal lawsuit and why being at the certain percentile is important, but then also with the ending of the public health emergency, what that's going to mean for them?
Right. The federal requirement is 95%, and the state is held to that requirement. And a lot of the waivers that are in place now, as the public health emergency ends, some of the waivers that are in place will also end, like supplements. Currently, supplements for any household that's receiving a food and nutrition services benefit, every household, regardless of what level they qualified for based on income, with the supplement given at the end of the month, they receive a total allotment for whatever their household size is. So everybody that qualifies for any amount receives the full allotment, and that has been going on since about March of 2020, so it likely will carry over into the beginning of next year, so almost 3 years now. So when those waivers end, those supplements will also end, and of course, there's been an advisory to people receiving the benefit that it was just a temporary thing, but because it's been a long process and people have received it for a long period of time, of course it becomes part of what budget they depend on. So we know that that's going to be a large adjustment for the people who are receiving food and nutrition services. And right now, because of the still being under the public health emergency, the state is not being punitive for counties that are not meeting the 95% requirement. And that has a lot to do with why they have allocated additional money for additional help to ensure that the applications are being processed at 95%.
So Brian and I meet with the state representative once a month to talk about our numbers, what strategies we're using. I asked her what the state was going to do to prepare people to let them know that their benefits would be decreasing, and she explained that they're putting together a very robust process to be able to identify folks who are getting those benefits and what the reductions will be, and so that they will have advance notice that it's coming. However, I'm not sure I think people are still going to be upset when that amount gets taken away. So we're prepared, sort of.
Yes.
We know that it's going to be an issue.
Yeah, your phone will be ringing off the hook.
It will. Mhm.
That's correct. And we realize that the increase in applications, a lot of the applications increased because the redeterminations have been suspended for so long, over a long period of time. When they resumed redeterminations, some people did not complete the redetermination paperwork and get it back in. So when they didn't do that and the case terminated, then then they applied, of course, to restart the process, and then so the high volume is in the area of applications now. That's sort of what has evolved. Mm-hmm. And of course, the extension of redeterminations, that waiver eventually will go away. So some point that we've been told at least through the end of December or into January, that would continue, but beyond that, we have no definite answer on when it will go away, but we know it's coming.
Okay.
I'd also like to report on the low-income household water assistance program. From July 1st to the end of October, we have assisted 564 households. The amount approved for those households was $194,823, and the remaining amount at the end of October was $135,758 for that program. We also will begin December 1st, the Low Income Energy Assistance Program, and there's an information sheet in your packet which sort of outlines the main guidelines of the program. The program begins December 1st, and in the month of December, it is open to people who are 60 and over or who are disabled, receiving SSI, Social Security disability, or VA disability, and also are receiving a service through the Division of Aging and Adult Services. So the key to that priority group is that they must be receiving a service through Division of Aging and Adult Services or be 60 and over. You only have to have one person in the household. If any household has anybody that fits that priority group, December is a month, and that is the priority group that can apply in the month of December. Beginning January 1st, the program is open to any household to apply after that. And then the program ends March 31st or until all funds are exhausted. So if the funds are exhausted prior to March, then the program would end at the point the funds are exhausted. We have received word from Health and Human Services that there will be an automated LEAP payment for those who received in the priority group in the fiscal year 2021-2022, and also are currently receiving a food and nutrition services benefit. That makes them categorically eligible for it. If they're currently eligible for F&S, then they get the payment automatically if they received it in the priority group last year. Those households will be notified by mail. So they will receive a notice that they're going to be receiving an automated payment. They do not have to make a separate application, but they'll be notified of that in advance. And anybody who does not receive that notice would need to make an application. We have our agency at 203 Government Circle. Applications may be made in person there. Applications may be made by telephone at our economic services line, which is 252-902-1352. We can connect an applicant with somebody who can do an application by phone if they wish to do it that way. It is also available online at epass.nc.gov, and all of this information will be in our press release that will go out the latter part of this month. We also will be announcing in that press release community partner locations that will also have advertised hours where people can go in the community to those sites and make an application if they would like to. So the way of the portals to apply are very user-friendly, because if you like using the computer, you can do it that way. If you want to do it the old school way and call us and do one by phone, it can be done that way. Or if you actually want to come in and get the piece of paper and do it that way, that's an option. So there are several ways to apply, and we encouraged people 60 and over to apply in December, because that is the designated time. But if not, any time after December, you can apply at that time also. So I'm happy to answer any questions about the Low Income Energy Assistance Program.
Any questions? Thank you, Brian.
Thank you.
Appreciate it. Okay, now we'll have a director's report. Ms. Rochelle?
Several weeks ago, we met with Pastor Coles, who has a father's group, a men's group that he runs, and he came and met with us regarding the services and a little bit about the group that he offers. And throughout that conversation, what we really came to understand is the limited number of services there are for men specifically in Pitt County. So I reached out to Dr. Silvernail to talk about how we could kind of bridge that gap, both for the men and their importance within their family and their overall health. So we're putting together an action group, I guess you would call it, and we're going to be talking with the health department to try to do a program where it's the social emotional well-being of men as well as their physical health. What we know is that fathers are a very important part of their family and important to the growth and emotional well-being of their children. So how do we support them? How do we strengthen them? And putting our heads together. There's a group in Winston-Salem who actually has, through their health department, has a father's group, a men's group. So we're not going to necessarily have to reinvent the wheel. We'll be able to use that information as well. So we're very excited about that. Also, we want to partner with the health department around their safe sleep program for infants. We know that this time of year, typically, we have unsafe sleep fatalities with infants, and whatever we could do to get ahead of that and prevent that, we would like to be able to partner with them to not only do education, and not just for a mom, but for dads as well, and also be able to provide porta-cribs if they have an unsafe sleep situation in their home, and to get out there to do some early intervention with that. In the last 2 weeks, we have had 2 unsafe sleep fatalities in Pitt County, so we're hoping to prevent future problems and be able to get out there early and be able to provide some assistance. And although it's not on the agenda, I just want to let folks know that November is Adoption Month. So according to the data for the United States, there's over 117,000 children available to be adopted. And the theme of this National Adoption Month is Small Steps to Open Doors. And we know that there are many youth out there who face challenges, the older youth who also have a difficult time being adopted but still want their forever family. So I just want to bring that forward to recognize that this is Adoption Month, and for those families who may be interested in adopting a child, no matter what age, to contact the department and, be able to look into it and find out what criteria is needed and what you'd be able to do to bring one of those children into your home.
Any questions for Ms. Rochelle? Okay, you want to talk about the upcoming events?
Sure. So Veterans Day is Friday, November 11th, and for all those veterans, men and women, just want to say how much we respect the work that you've done for this country and the sacrifices that you've made. And it truly is a day of recognition for you all. And Thanksgiving holiday will also be occurring in November, the 24th and the 25th. And it's our time, both as an agency and as a family, to be thankful for all the wonderful things that have happened. I will be saying my blessings this year for being able to be here in Pitt County and what I've experienced and the wonderful staff here. So that will be my first blessing on Thanksgiving.
Great. Okay, we'll move now into board member comments. Does anyone have anything they would like to offer this afternoon?
Well, just to extend appreciation to all of the staff who have been working under stressful conditions to make things happen and to meet deadlines and objectives, and very thankful for our director for staying the month. So she came back, and so we're very thankful for that, and happy Veterans Day and happy Thanksgiving.
I'll just say thank you to the staff and the community that have participated in so many different initiatives. The Bready Bear initiative, I was able to give those to several public school teachers and principals during Principals Month. So that was a really fun thing, but I know a lot of staff hands went into making that happen. And then the holiday cheer for both foster youth and adult services was able to share that information with people that were asking me about it yesterday for the youth. And my family has done the adult services holiday cheer for years, and it's our favorite thing to do around the holidays. So I just really encourage people to participate. But I also have been a staff on the organizing end, and I know how much organization that takes. So many, many thanks to the staff that organize those projects and get a lot of joy from it, but also give a lot of work to it. So hopefully those in the room and in the community will participate in those very worthwhile projects.
Thank you. I too want to thank everyone for all the hard work that y'all do every day to take care of our vulnerable residents here in Pitt County. I'm grateful to the leadership Ms. Rochelle has brought to the agency over the last month. I am glad she came back. And I'm excited about the things to come and the work that's being done to really address some of the issues that we've had in the past, and we want to do. We want to be able to be a board that can really provide as much support to her and the agency as possible. So thank you again for your work. Do I have a motion for us to adjourn?
So moved.
Second.
All in favor?
Aye.
Aye.
Thank you. See you next month.